This is Nurse Hattie. Today is my 10th day post-surgery. I want to show you what I did for the first week in order to get myself ready after the surgery to decrease inflammation and to continue to increase my range of motion angle on my knee. Well, I want to show you first what my knee looks like. There you go. We had 2 incisions. It's a little swollen still, as you can see right here and right here. And all that's going to go down with time. Remember, it's only been 10 days. The stitches were taken off 7 days after surgery, which was Thursday. I want to show you the exercises that I did to increase my range of motion. First of all, I put my feet on the foam roll and I did rotation. I did 20 of these one way and 20 the other way. It's very important that you do these exercises so you don't get blood clots, which is a likely possibility after having surgery. Flex and point to keep the blood flow going and to keep the muscles active, and also to facilitate and move around the fluid that builds on the area where the surgery has been done. So here we go. The other thing that we do, I put my feet on the foam roll and then I lengthened my legs out and then brought them back in. At first, when I started doing this, this is as far as I could go. The inflammation was quite high, and so therefore I could not bend my knee. Now I have a little bit better range of motion than 90%. My goal is for the next week to increase that, and in 3 weeks I want to be able to do everything I used to do before except without the pain. All right, the next exercise that I did was to stretch the hamstring area. So I placed my feet on the foam roll and folded forward just like this. By flexing the toes, you are lengthening the back of the soleus and the gastrocnemius and the hamstring muscle. The other exercise that I did was to point the toes and fold forward, and this got the anterior posterior tibialis to lengthen out. All right, so those were some of the exercises. 5 days after surgery, I began to do miniature squats. What they looked like was this. So I held onto the chair, and then I separated my feet, and I just went down about 15 to 20 degrees. All I did was right here, baby squats. Inhale, exhale, pressing through the heels, and here I was engaging my quadriceps and hamstrings. Another exercise that I did was to stretch the back of the Achilles. And so I brought my surgical leg back and I moved forward, bending the front knee. And then of course you want to do it on both sides. Also, you want to do heel raises. Standing position, you're engaging all the muscles up and down. And you want to do 10 facing forward, 10 in first position, and then 10, the inverted position. All right. And that's how I did for the first week. When I went to the doctor's 7 days later for him to remove my stitches, he was impressed with how well I was walking. He even said, "Wow, you're walking so well." And I said, "Yes, I've been working out." All right, on our next video, I'm going to show you what they did for the surgical procedure.